So that is referred to the picture on the left, where it's the caput, which is common, goes away within a few hours, and by the next day it's usually gone. Whereas the caput hematoma can last for a few months. Okay, so that worries parents quite a bit. So I just thought I'll introduce that idea. Right. Next. Purple hands and feet. So when your baby is born, they tend to have cold purple hands and feet. Which gets better over the next couple of days. So if your baby is feeling a bit cold, you can use some mints, use some socks. But a lot of parents worry about the oxygen levels and all those things when they see the baby's hand and feet looking slightly on the purple side. So the important thing to remember is that if the baby is breathing normally and the baby's tongue and lips are nice and thick, you don't have to worry. More than the lips, the tongue is nice and red, nothing to worry. So purple hands and feet are quite normal. So if your baby is feeling a bit cold, you can put some mittens on, some socks on, and that will settle. Alright? So I'm going to just keep moving on with the little problems that you may come across. So it keeps going. Next. These blue spots, they're called Mongolian blue spots. You may find on the back of the babies, especially in our Asian babies, they tend to be more than Caucasian babies. So nobody actually knows the cause of it. People have various theories that there's pigmentation that gets moves on from the deeper surfaces to the superficial areas, and they get arrested in that process and then form these blue spots. So a lot of parents again cause a lot of anxiety. My baby's battered or bruised or whatever, but it's all normal, and by the age of 2 to 3 years it disappears. Okay? Can everyone hear me at the end, at the back? Yeah? Right. So next, this newborn baby rash called erythema toxica. Okay? It's a very common rash. Your baby gets this blotchy, red, angry-looking rash with little white spots. You might see these white little pimples type thing appearing at it. Usually occurs 2 to 5 days after birth, and can take up to about 3 to 4 weeks to disappear. So that causes a lot of anxiety to parents, heat, a lot of explanation given, is it the food that I'm eating, all those questions I get asked time and time again. But it's none of that. It's just a newborn baby rash, almost like the baby skin's reaction to be born, really. Okay? So that disappears after about 3 to 4 weeks. You don't need to do anything. I like the use of virgin coconut oil for this rash, particularly, and the skin resolves. Okay? After a few weeks. Next, have any of you heard about the stork bite? Okay, so you've all seen these little cartoons where the stork brings the babies to the mother and father, right? So obviously there's no stork involved. It's this little reddish rash that occurs on the back of the head and the front. So this is called the angel's kiss. And together they're called the stork bite. So it's just as though the baby was held with the stork beak, right? The front and the back. You've seen it in the pictures, right? You've seen it? So that's called the stork bite. Okay? But that disappears within a few weeks. It can last up to about 2 months, but it disappears. Again, causes a lot of anxiety for the parents, and they get a bit worried as to what it might be. Okay? So look out for it in your newborn. Invariably, about 80% of the babies here will have this stork bite. Okay? Right, moving on. Jaundice. So most of you have heard of the term jaundice. Most of you get worried about jaundice. Most parents get worried about jaundice. So why do babies turn yellow? Any thoughts? Any ideas? Right, so let me explain the science behind it. So now inside you, your baby's hemoglobin levels are very high, just to increase the efficiency of their oxygen delivery. Okay, so from your oxygen in your blood into the baby's blood. So their hemoglobin levels are high. When the babies are born, they're breathing for themselves, so they don't need that system anymore, right? So the hemoglobin, which is a red pigment, gets broken down in the red blood cells, and they produce a yellow pigment called bilirubin. Okay? So it's quite normal and physiological for babies to turn a bit yellow on day 3, day 4. And as long as the babies are feeding well, passing urine well, and the yellowness is not particularly bad, you don't have anything to worry. Okay? So that's why I just touch about jaundice. But even the jaundice occurs very early on, like in the pregnancy, in the newborn period. So between like 1 to 2 days after birth, and it's very, very yellow, and the babies are very sleepy and not feeding, then you need to seek medical advice. Okay? So that's when we get involved, and then you would have seen this in the movies and all that, the babies get put under the lights, phototherapy. So that's just to think about jaundice and yellowness. Okay, so babies do tend to turn a bit yellow on day 3, day 4, and as I said, as long as the baby is feeding well, passing urine well, waking up for feeds and not particularly sleepy, you've got nothing to worry. Okay? Even the eyes turn a bit yellow, so I get calls in the middle of the night, I get calls at all sorts of hours with, "Doctor, my baby's eyes are yellow, what do I do?" So as long as the baby is feeding well and it's not particularly yellow, then it's nothing to worry about. But as I said, if it occurs very early on, like on the first day or the second day, and very deeply yellow, very sleepy, then you need to get the baby seen. Is that clear? So I don't want to make it too scientific. It's just the boring science behind the whole hemoglobin. Okay? Right. Umbilical taught how to clean the baby and bath the baby and wash the baby. There's nothing special you need to do. So when the baby comes down, the baby's umbilical cord gets and the little tub gets left behind on your baby, right? And that falls off, they just let it dry and leave it open to the air. So nothing to get too concerned. The base of the umbilical turns red, then you need to worry about it. Okay? So other than that, majority of the time the umbilical cord has no issues and you're fine to deal with the baby as it is. Alright? Then you see the picture at the bottom. So this is even you can tell that there's something wrong here, right? There's redness, the baby's tummy is quite distended and swollen, so there's something wrong there, right? This is not to frighten you, just so that warn you that you can look out for this in case it happens. Very rarely does it happen, so you don't need to worry about it too much. Right, so once that cord falls off, day 5 to day 7, just keep the area clean, as I said, dab it dry and leave it open to the air. Sometimes, up to about 3 weeks, we can get a bit of bleeding that occurs. Again, panic calls in the middle of the night, okay? I need to learn to switch my phone off, but I can't. But that's one of the calls that I get with bleeding umbilicals. Okay, so that is quite common to get a bit of blood, nothing to worry. Again, just keep it clean, keep it dry, keep it open, and it's set. Right, so one of the complications that can occur is an umbilical granuloma, okay? So that is slightly different in that it's a bit of an overgrowth that occurs about a month later. So the baby is about a month old and has got this little flesh-like growth that occurs, and that's called granuloma. So it doesn't cause any problems to the baby, it doesn't cause any pain. It's more of a nuisance to you than to the baby because it's constantly discharging, soiling the baby's clothes, etc. So when that occurs, we tend to do some treatment so that we can burn that bit of flesh off. We use chemical burns to burn it off, and that disappears. Alright? So that's called an umbilical granuloma. That very rarely can occur. So if it occurs in your baby, you know exactly what it is, and you will know what to do. Okay? Next. So can anybody just see what's wrong with this baby's breast? Obviously, because that's what we're talking about. Anything? Anybody? So, I mean, the picture is not very clear when it's projected, but the baby's breasts are swollen, right? So that is again something that can occur. Lots of things get done to it at home with your grandmothers, mothers, the maid, the nanny, whoever, we have lots of theories about what to do and what not to do. You should do nothing, all right? So babies, due to the mother's hormones, male babies and female babies, can have swollen breasts. And they can be full of milk as well. If you squeeze it, there'll be milk coming out. It's called witch's milk, right? So, but you shouldn't do anything to it. Just leave it alone and it will disappear, right? If you go to interfere with it, the breast can get infected, form an abscess, and then cause lots of problems where it needs to be drained, the baby will need antibiotics and all the rest. So you have a lot of people telling you things to do at home, what most of my mothers tell me, but the thing is to just smile and just nod your head and not do what you have to do, okay? So you must do nothing with it, alright? If you do go to interfere with it, you might end up like this. Can you see this baby? Not very happy, red, inflamed, abscess. So unnecessarily needing antibiotics, needing surgical procedures to drain, all of those things. So swollen breast is common and it occurs in about 6 out of 10 babies and it will disappear with time. It's due to your hormones acting on the baby's breast. Simple as that. Any questions so far? No. Right. So just getting into the genitalia, female babies, they can have a period like this on day 3 to day 4. Okay? So that is quite common. Again, I get calls in the middle of the night that, oh my gosh, my baby is having my baby is bleeding. That's the call that I get normally, and that's quite normal. Day 4, 5, 6, it can last, and then it disappears. Okay? Again, it's the mother's hormones acting on the baby's uterus and causing a period like this. So in female babies, in baby girls. Right. Sticky eyes. Again, very common. So we are constantly producing tears, right? You and I, we are constantly producing tears. We don't feel it because we are constantly draining those tears, right? We've got little ducts that drain tears. In newborns, those ducts get blocked. Okay? And they form this sticky yellow discharge and cause all sorts of problems. So lots of unnecessary antibiotics and creams and ointments and all those things get prescribed unnecessarily. All you have to do is just massage the inner corner of the eye. Okay? Massage the inner corner of the eye and that disappears. So this can occur throughout the first year of life. So it can last up to about a year. So every time it happens, you just clean it with some cool boiled water and cotton. But to prevent it from occurring, you need to massage the inner corner of the eye. Just a couple of strokes. So when you're feeding the baby, just stroke the baby's eye like this a couple of times, and then that's what happens. Is that clear? Yeah. So that's a common problem, common complaint and common concern, and unnecessarily overtreated. Right? Next, colic. Who has heard of colic? Raise your hands. Who has heard of colic? Well, if you haven't heard, you will. Okay? So, what is colic? Colic is usually incessant crying. Definition is that incessant crying for no apparent reason for 3 hours in a row, for 3 days of the week, and for 3 weeks. So that's the definition. Okay, that's the textbook definition. And my middle daughter has colic, and you could set your clock with the way that she starts crying. Okay? Every day at 6 o'clock in the evening, they start. So that is what colic is. Nobody actually knows the cause of colic. Okay? Everybody wants to ask why is the baby colicky, what am I doing, what's going on, but nobody actually knows the cause of colic. There are certain situations that can make colic worse or better, but nobody actually knows the cause of colic. So it usually starts at about 2 to 3 weeks of age. It peaks at 6 weeks, and by 3 to 2 months it's gone. Alright? It goes. So, whatever happens, don't lose any hair over it. It will go. Okay? So, by 3 to 4 months, it's gone. What can we do to minimize colic when your baby is colicky? So, we tend to use, sorry, that's again a warning sign.
Obviously, if the baby has fever, weight loss, poor feeding, then you need to get the baby seen. You can't just put it down to colic. But colicky babies otherwise is feeding well, putting on weight normally, and generally otherwise well. Okay? So that's important to keep in mind that the baby is otherwise well. So what can we do to manage colics? We've got probiotics that we tend to use. We've got hot water bottle massage that you can try to manage those colicky spells. Baby massage can sometimes help treat the colic. So that's a picture of a baby getting the massage. Then positioning and movement. Certain positions babies like. They like to get swaddled. So remember we're in a hot country, so if you're swaddling, use a light cloth. So you can see that colicky baby. You can see the baby crying and the father is trying to calm that baby down and putting the baby in that position. So perhaps that baby likes that position. So you might, what works for one baby doesn't work for the other. So you need to find out what works for your baby and then figure it out. Okay. So then what else? Swaddling, as I said,